St. Peter's Hospital has been a leader in cardiac surgery for many years. That's something that we're very proud of. I'd like to share a success story. A patient who had cardiac surgery at St. Peter's Hospital. His name is Jim Layton. His daughter was so concerned about her father, she did some research and asked friends, and who recommended that he come to St. Peter's Hospital for his heart surgery.
About 14 years ago, I was diagnosed with atrial fibrillation. Needless to say, I needed to have a life change. I had been going through, tests every 6 months. The cardiologist had noticed a heart murmur and possibly a leaking valve. So we did some echocardiograms. We did them on a regular basis, and they were progressively getting worse over the past 2 or 3 years. But I still didn't think that it was really anything to worry about. I still thought I was doing well. I had dropped 40 pounds and feeling good, but the valves were still leaking and increasingly leaking. And finally, after one echo, he said, I really think you need to get this addressed, and the sooner the better. I went in, and the next thing I know, I'm in my recovery room. Kathy had prepared the family on what to expect the way I looked.
Yeah.
And
yeah.
It wasn't too pretty from what I understand. I mean,
those first couple hours, they're touch and go, and it's scary. And from my perspective, my dad is our hero, and there's never been anything that he wasn't able to take care of and do himself and for us. And so for his health at that point to be so uncertain and to know that really his life was in somebody else's hands, it was very scary. Thank goodness that we are such a strong family unit, and in so many ways, all the people at St. Peter's, I feel like really became part of our family along the way too.
We offer everything, ranging from complex cardiac surgery to valve replacement, to coronary artery bypass grafting, to pacemakers, to ablation for arrhythmias. We started in the past year doing an exciting new procedure called TAVR for short, which stands for transcatheter aortic valve replacement. Essentially replacing your aortic valve without having to open your chest.
With the help of St. Peter's, the education I received prior to going into surgery, it was a reality. We took this class beforehand. I think it was a few days before surgery, and told me every step of the way what to expect.
Our best kept secret, I believe, at St. Peter's Hospital is our Rhythm Center. Our Rhythm Center has been led by Guillermo Sosa Suarez, who is a phenomenal doctor who's provided expertise in rhythm disturbances and ICD implants as well as pacemakers. We have clinical nurse specialists, mid-level providers with no less than 15 years experience in cardiac care. We are a magnet facility at St. Peter's Hospital, very proud of nursing excellence. Certified critical care nurses and cardiac and vascular nurses provide care to our patients here. I am most proud of our staff.
The 5 days in the hospital, which I'd never been in before, it's worthwhile. I've got a lot to live for. 2 grandchildren, 1 on the way.
But I'm very pleased and very proud to say that we offer cardiac catheterizations and stenting at 2 of our hospitals, at St. Peter's Hospital in Albany and at Samaritan Hospital in Troy. And we've been able to achieve great success, great outcomes, great quality care in both of those settings. One of the other aspects of our merger that really has been very positive is that we're able to share best practices, both in Albany as well as in Troy, and to really develop protocols and practices that are the best practice and that allow us to really improve and raise the level of our care every single day. I support the American Heart Association 100%, and I urge others, I urge all of you to support them as well.